Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today we're going to talk about urinary health. I think that it's really important to discuss bodily functions in an open, honest, and scientific manner. So I'm going to talk to you guys about this today, and we're going to learn some things together. So first up, if we're going to talk about how to maintain the system, let's talk about what it's comprised of and also how it works. So your urinary tract is your kidneys, your ureter, which are the tubes that go from your kidneys down to your bladder, and then also your urethra. And there's a sphincter there. So the urinary system's job is to filter your blood, and when it does so, create urine as a waste byproduct. So once your body has absorbed the nutrients from your food and converted it into energy, then your body takes the leftover products and puts it in the bowel and in the blood. Your kidneys and your urinary tract really help your body to eliminate this liquid waste, and it's called urea. And it's really important because it keeps certain chemicals and water balanced in your body. And those chemicals include potassium and sodium. So urea is produced when you eat foods that contain protein. That includes meat, poultry, and even certain vegetables. And it's broken down inside of your body. So the urea that is present from consuming these substances gets carried into your bloodstream to the kidneys. And in your kidneys, it is removed along with water and other waste in your body in the form of urine that can then be excreted. Your kidneys are also really important for other functions in your body, like regulating your blood pressure, producing erythropoietin, which is a substance in your body that controls your red blood cell production, which occurs in your bone marrow. And then your kidneys regulate the acid-base balance in your body and conserve fluids. So there's a lot more that the kidney is involved in, even though we generally just tend to think of them as urinary organs. So the kidney and the urinary system in general have a couple of different functions. Most folks have 2 kidneys, and they're generally like a purplish, reddish brown color, and they're generally located just below your ribs towards the midline of your body in the back. So they work to remove waste products and drugs from your body, balancing your body's fluids, releasing hormones in order to regulate your blood pressure, and they also control that red blood cell production. So your kidneys are very important. And the way that they remove urea from your blood is through these very small filtering units that are called nephrons. And each nephron is made up of a ball that is formed of teeny tiny blood capillaries. And that's referred to as a glomerulus. And so there's a small tube down there called a renal tubule. I know that one is much easier to remember. The tubule is a tube. So the urea, along with the waste and any other waste substances like those chemicals, like the potassium, the sodium, etc., form urine as they pass through the nephrons and down those renal tubules of the kidney. Then you get to the ureters. So the ureters are also tubes. They're really narrow and they take the urine from the kidneys down to your bladder. Kind of like a little chute, like a garbage chute. And it's just shunting all of that down from the kidneys to your bladder. Then muscles in your ureter walls tighten and relax to help force your urine downward and away from your kidneys. So if urine backs up or it ends up standing still instead of being forced downward, then you can get a kidney infection. About every 10 to 15 seconds, your urine is generally emptied in small batches into your bladder from the ureters. Once we get to the bladder, we are actually seeing a little triangle-shaped hollow organ, and it's located in your lower abdomen. Your bladder is anchored in place by some ligaments that are attached to other organs and your pelvic bones. So your bladder's walls relax and expand to store your urine, and then they contract and flatten to empty out that urine through your urethra. The typical healthy adult bladder can hold up to about 2 cups of urine for 2 to 5 hours. So that's really important to keep in mind if you ever decide to hold it. Holding it for too long can be really bad for your body, and it can result in bladder infections as well. So when we look at this part of the body, they have some landmarks that are used to describe the location of anything that is kind of irregular in your bladder. And these include the dome, which is the roof part of your bladder, the posterior wall, which is the back part, the right and left lateral walls, and the trigon, which is a triangle-shaped area near where your urethra and your bladder meet. So in this part of your body, you also have a few layers of your bladder. You have a fat layer, and then a thick muscle layer, and then an area that's full of blood vessels, and then the bladder lining that has special cells in there. So when you get there, you also have these 2 sphincter muscles. And we often think of the sphincter as being associated with excreting feces. But a sphincter is really just a circular muscle that can open and close to allow the passage of types of fluids or constituent components within your body. So you also have them at the stomach area and in your bladder area. So there are 2 sphincter muscles around the bladder, and they help keep the urine from leaking out of your body by closing tightly like a rubber band kind of around the opening of the bladder. Think about it as kind of like when you go to get a goldfish or any other type of fish really from the local store as a pet, and they give you the bag with the fish in it and they kind of rubber band and tie off the top of that bag just to make sure that nothing is leaking out or escaping. There are also several nerves in your bladder, and those nerves are responsible for letting you know when it's time to urinate, when it's time to truly empty your bladder. Once we reach this far south in your urinary tract system, then you get to the urethra, and that is a tube that helps you to pass urine outside of your body. When it's time to pee, your brain signals your bladder muscles to go ahead and tighten to squeeze that urine out. And then the brain is also signaling at the same time for those circular sphincter muscles to relax, to let the urine get out of your bladder through the urethra. And when everything happens in the right order, you pee normally. So There are a couple things to know at this point, now that we know how urination works, how your urinary tract system works. When you're checking your urine to see how your health is, you want to go ahead and take a look in the bowl. So normal, healthy urine is going to be a really pale color, like straw or a transparent yellow. If it's darker yellow or even honey colored, then you need to drink more water. If it's very dark to even like a brownish color, you may have a liver problem or may be severely dehydrated. If you have pink or red urine, it may mean that you have blood in your urine. And it may not be totally pink. It may just have a pinkish tinge to it. But it's important to go ahead and speak with your doctor about that, just in case it's something a little more serious. Lastly, if your urine seems kind of cloudy, you may also have a UTI. We're going to go on a quick break, and when we come back, we are going to talk some more about urinary tract health and your kidneys. Stay tuned.
You really can't underestimate the importance of having the right creative work for your brand or your product. Whether it's a logo, a website, a book cover, or an ad campaign, you really need a quality design to make that big difference pop and deliver your overall engagement and success in a competitive market. That's where Design Crowd comes in. Design Crowd has over 750,000 designers from Sydney to San Francisco ready to help you with awesome creative ideas. They make crowdsourcing work for you. So if you need a logo or you're working on your creative branding, you can go to designcrowd.com and post a brief describing the design you need. And then within about 2 to 7 days, you'll receive up to over 100 different designs from designers around the world. Then you pick the best design and approve payment to the designer. So you're only paying for the design that you want. It takes a lot of the guesswork out of freelancing and out of crowdsourcing. And you don't have to be a huge company like Harvard Business School to use Design Crowd, although they have used it as well. You can start a project on Design Crowd for as little as $99. And if you go right now to designcrowd.com/health and wellness or enter the promo code health and wellness on their website, then our health and wellness listeners will receive up to $150 off of your design project. That's designcrowd.com/health and wellness or entering that promo code health and wellness.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Introducing the concept of urinary tract health and how your urinary tract works, from your kidneys all the way down through your urethra. Now we're going to talk about urinary tract health and what we really mean by that. So your urinary tract has the kidneys, your bladder, and the tubes that go to and from those organs. So the kidneys have the ureters, which are a pair of tubules, one from each kidney, that goes down to the bladder to give you a real expressway to the bladder, more or less. And then the tube going from the bladder to the outside of your body to allow you to excrete urine is the urethra. So combined, these organs produce urine and eliminate it from your body. Your urinary tract health, when we talk about this as a concept, is really speaking as to how well your urinary system is working in removing these waste products like the sodium and potassium excess and the excess water from your body and producing it and controlling your urine. And it also includes any types of disorders or illnesses that might occur within the tract. Those problems can affect your urinary tract as a whole, or even just certain parts of your urinary tract, like your bladder or your kidneys. There are many different types of disorders that can affect your urinary tract health. Those can range from urinary tract infections, more commonly referred to as UTIs, leakage of your urine, or urinary incontinence is another name for that, or even kidney stones. We're going to talk about a few of those today, and I'd like to start with kidney stones. We're going to talk about what they are, how they're made, and how to recognize when you may have one. So kidney stones are also referred to as renal calculi. Renal is really referring to kidneys, and calculi is like stones. It's a buildup of material in your body. And we really see this reflected in the verbiage for it, unsurprisingly. Renal derives from the Latin word for kidneys, and calculi or calculus means pebble in Latin. So it's literally kidney stones in Latin. Sometimes this is also referred to as being nephrolithiasis. Nephro comes from the Greek form of kidney, and lithiasis is the Greek word for stone, or rather lithos was the original Greek word for stone, from which nephrolithiasis comes from. So really, these are just two different ways of referring to the same thing, one in Latin and one in Greek. So really, a stone by any other name is still a kidney stone, whether that be in Latin or in Greek. I know that didn't rhyme and it was a terrible joke. I'm sorry. However, these are also sometimes referred to as urolithiasis, which is meaning urinary stones. And these are hard deposits that are made of minerals and salts that form inside of your kidneys. If you have ever taken an anthropology or archaeology course, you may be familiar with the term lithics as a branch that studies stones, like stone tools. Of course, if you have also studied anything related to geology, you would be familiar with that as well. But that's what made me want to look into it, because in anthropology, we refer to lithics, but also we refer to dental calculus, or calculi, the plural form of calculus. And that is that stone buildup. So I wanted to see where these really derive from. And I think that it's interesting that we will use these Greek and these Latin terms interchangeably, because they really are able to be interchanged, and it is just more proof historically of how folks came to a lot of the same conclusions in different cultures and different languages in different ways, but they were able to observe these same facts in folks, and they became both ingrained in our medical vernacular, at least in Western cultures. As an anthropologist, I just find that fascinating. So I wanted to share that with you guys. But I digress. What can really cause these? Well, diet, excess body weight, and certain types of medical conditions or even supplements and medication can all cause kidney stones. And they can affect any part of your urinary tract, your kidneys, even your bladder. A lot of times these stones are formed when your urine gets too concentrated, when you have an imbalance of too many of those minerals and not enough water in the body. And that can really cause those minerals to crystallize and stick together. And as they do, of course, they continue getting larger. It's just like a snowball. It is just gaining more mass as it is chilling in your kidneys. So when you pass the kidney stones, it can be pretty painful. But typically, kidney stones don't cause permanent damage if they're recognized in a timely fashion. So that's why it's important to know the signs and symptoms. Depending on your personal circumstances, you might not need to do anything other than take some pain meds and drink a lot of water to pass those kidney stones. But in other instances, if those stones get lodged in your urinary tract, like in those ureters or in the urethra, you could get a urinary infection or get complications that may even require surgery. If you've already had kidney stones, then your doctor really might recommend some preventative treatment methods to reduce your risk of getting them again, especially if you're at an increased risk of developing them again. So now that we know what they are and where they live and how they accumulate, let's talk about how to know if that is what is causing you pain. So kidney stones usually don't cause symptoms until they really start moving around inside your kidney or go into those small tubes that connect the kidneys to the bladder, your ureters. So if they get stuck in the ureter, it can block the flow of urine and then cause the kidney to swell, because the kidney is in the meantime still collecting all of that water and the sodium and potassium and whatnot through the glomerulus and creating urine. So if it's stuck and the tube is clogged, it's just going to keep backing up, kind of like if there's a clog in your kitchen sink and you're still filling it with water and it just keeps rising. But in this case, since the kidney is an enclosed system, kind of like a balloon, it's not going to overflow into the floor or your abdominal floor in this case. Instead, it's just going to cause that organ to continue to swell. And then your ureter, the tube in which the kidney stone is stuck, is going to spasm. And that can be very painful. If it gets to that point, then you might start experiencing some severe, sharp pain in your side and back below your ribs. You might have some pain that radiates to your lower abdomen and your groin area. The pain may fluctuate in intensity and or come in waves, and you may get pain or burning sensations when you pee. Other signs and symptoms that are more visible might be pink, red, or brown urine. Any of those colors in your urine can indicate blood, or they could also indicate that you have a blockage. If you have cloudy or foul-smelling urine, that can indicate that there may be bacteria present in your urine. If you have a persistent need to urinate, or you're urinating more often than usual, or urinating only in small amounts, then it may also be kidney stones, especially if it's accompanied with that pain. Nausea and vomiting, as well as fever and chills, may also be present with that if you have an infection. So, I think it's important to understand the combination of these symptoms because it has some pain radiating in your lower abdomen and groin area. And that can be a bunch of different organs that are involved there. You want to be able to know the difference between what's really perhaps kidney stone pain versus your appendix rupturing. And by learning more about our internal organs, how they should function, and what they seem like when things go awry, it can really help us make informed decisions and being great partners for our doctors in our own medical health and treatment plans. Personally, I just like to be as informed as possible so that when I have these conversations with my doctor, we are both on the same page and can have a very informed discussion. So I want them to also be very informed and to listen to me and my feelings about my treatment plan. But I think that that also comes with a component where I should be putting in some of the intellectual effort as well. So I'm expending some intellectual intelligence for this, and they are using emotional intelligence in taking into account what I need. Now, that's just me. That's personally what I like in my doctor-patient relationship. It is up to you how you interact with your doctor. But for me, this is what works best and what makes me the most comfortable. Because I find that when I understand the hows and whys of everything, that things are less scary because there is less unknown. We're going to go on another break, and when we come back, we're going to talk more about kidney stones, some causes of them, and treatments. Stay tuned.
You really can't underestimate the importance of having the right creative work for your brand or your product. Whether it's a logo, a website, a book cover, or an ad campaign, you really need a quality design to make that big difference pop and deliver your overall engagement and success in a competitive market. That's where Design Crowd comes in. Design Crowd has over 750,000 designers from Sydney to San Francisco ready to help you with awesome creative ideas. They make crowdsourcing work for you. So if you need a logo or you're working on your creative branding, you can go to designcrowd.com and post a brief describing the design you need. And then within about 2 to 7 days, you'll receive up to over 100 different designs from designers around the world. Then you pick the best design and approve payment to the designer. So you're only paying for the design that you want. It takes a lot of the guesswork out of freelancing and out of crowdsourcing. And you don't have to be a huge company like Harvard Business School to use Design Crowd, although they have used it as well. You can start a project on Design Crowd for as little as $99. And if you go right now to designcrowd.com/health and wellness or enter the promo code health and wellness on their website, then our health and wellness listeners will receive up to $150 off of your design project. That's designcrowd.com/health and wellness or entering that promo code health and wellness.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
Stones, specifically how they form inside your body, and a brief look at what may cause them and how the symptoms may present if you do have kidney stones. Now we're going to talk a little more about some causes and types, as well as when to see a doctor. So, first up, when to see a doctor. We'll just go ahead and cover that important component. So, one thing to know is that pain from kidney stones can actually shift to a different location, or it can change in intensity because that stone is actively moving through your urinary tract. Remember, it's being pushed down into your bladder. So as it is slowly pushed, you're getting those spasms in your ureters. The tubules, they get stuck in, and that can mean that it's moving down your body and that certain parts might be more tender, especially if you have a bacterial infection building up in addition to that problem, or if your kidneys are swelling because they're getting backed up with urine, like that backed up sink. So it's important to make an appointment with your doctor if you start having any signs and symptoms that worry you. And specifically, if you're experiencing difficulty passing your urine, blood in your urine, so that pinkish, red, or brownish color, if you're having pain accompanied by fever and chills, or pain accompanied by nausea and vomiting, or pain that is so serious that you can't sit still or find a comfortable position, go ahead and call your doctor. That is the point at which you definitely need to speak with them, even if you are otherwise not super concerned. Everyone has different pain thresholds, and I think that is important to note. So if you aren't necessarily experiencing a ton of pain, but you have some of these other symptoms, you might want to call them, just in case, you guys. My sister once had her appendix rupture in her body, and I didn't think that it was that serious. Granted, I was only 11 and not Doogie Howser, MD, but she was about 10, I think. And when she was having this problem, she wasn't feeling well, but she stopped crying and just went to sleep for a while. But she started groaning in her sleep like she was in a lot of pain. And so our babysitter called my mom, and my mom had her do this test where she laid her on her back and then moved one leg up, bending the knee towards the chest while the other was out flat, and then the other. And when she yelled at a certain point in pain, my mom was like, okay, that's appendicitis. I'm coming to get her. And we went and had her appendix removed. And they said that if there had been another couple of hours, that she could have died. So in that instance, you might not have thought, like I did, that it was that serious, because she was just complaining of her tummy hurting and wasn't feeling great, but she laid down and went to sleep. But she seriously could have died if even another hour had passed before we were able to get her to the ER to get her appendix removed. So it's important to also keep in mind that just because you may have a higher pain threshold than others doesn't mean that it might not still be serious, like in the case of my sister. So if you're experiencing blood in the urine, or you're getting fever and chills, or nausea and vomiting, or difficulty passing urine coming from that pain, or you still can't sit or find a comfortable position, then go ahead and call your doctor. It is better to be safe and tend on the side of caution. After you explain your symptoms, they will generally let you know if they think you need to come in. Now, up next, we're talking about causes. Kidney stones a lot of times don't have a definitive cause. There are several factors that can increase your risk, though. Some kidney stones form when your urine has more crystal-forming substances, so those minerals like calcium, oxalate, or even uric acid, than the amount of fluid that your urine can dilute. So if you have more crystals to water, then you're going to have a more likely chance of them forming into crystals. I want you to think about it like if you are making a cake batter. So if you put in all of the flour and sugar and stuff, all of those dry ingredients, and then you only put in like 1/8 of a cup of water or other types of fluids when the cake calls for 3/4 of a cup or 1.5 cups, depending on what you're making, then your batter is going to be way too thick, and then when you go to cook it, it's going to come out gross and hard. Whereas if you put in the correct amount of fluid, it's going to come out right every time. But if you put in too much fluid, it's going to come out weird and runny. So your body normally is not going to get too much water. Hypernatremia is relatively rare. You're much more likely to get kidney stones in this case. So having that really thick batter that is coming out as this big hard block, That's what's happening in your body. So think of those minerals, the calcium, the oxalate, and the uric acid as being more of those crystal forming substances, or as being like the dry ingredients in your cake. So too much dry to too much wet, or too much calcium and not enough fluids, then your urine is going to lack substances that can prevent the crystals from sticking together. And that is the perfect environment for kidney stones to form in. So make sure you're drinking your water, guys. If you have not drank your water yet today, go ahead and take you a few big gulps to protect your kidneys. Knowing the type of kidney stone that you have also really helps determine the cause of your kidney stones. And it can also help you then prevent getting more kidney stones in the future. So try to save your kidney stone if you pass one, if at all possible, so that you can bring it to your doctor for analysis. I know that might sound gross, but a lot of us have bathroom cleaning gloves. You can pick one up out of the toilet with your bathroom cleaning gloves and then go ahead and drop it into a medicine bottle or something. I specifically say medicine bottle because my grandmother used to keep her kidney or gallstones one, I can't recall which, inside of a little prescription bottle from the pharmacy. I opened up the medicine cabinet once as a small child and was very surprised to see this little pebble inside of a pill bottle. And I'm like, that's not a pill. And my parents explained to me that that was a kidney stone, which I thought was absolutely fascinating. And I'm still fascinated to this day. But it's not just for the lulz. Indeed, doctors are really wanting you to try to save those so your doctor can figure out what the kidney stone is made of and therefore how to prevent it in the future. You may get stones formed from calcium or struvite stones or uric acid stones or even cysteine stones. Most kidney stones are going to be calcium stones, and they're usually calcium oxalate. Oxalate is something made in your body each day by your liver, or it can be absorbed from your diet. It comes in fruits and vegetables as well as nuts and chocolate. You can also get high doses of vitamin D or intestinal bypass surgery and different metabolic disorders that can increase your concentration of calcium or oxalate in your urine. So you can also get calcium phosphate stones. And that type of stone is more common in folks who have metabolic conditions, like renal tubular acidosis, or with folks who have to take medications to treat migraines or seizures. Struvite stones are typically formed in response to urinary tract infections. And so, in that way, if you have a UTI, you need to go ahead and get it treated ASAP. UTIs, as we'll discuss here in a little bit, are bacterial infections, and typically you are going to need to get antibiotics to resolve those. Just drinking cranberry juice is not gonna cut it. And if you have an untreated UTI, you can get these struvite stones, and they can grow very quickly and get quite large, sometimes without even giving you warning or not having many symptoms. Uric acid stones can also form in folks who are losing too much fluid from their bodies due to chronic diarrhea or malabsorption, or folks who eat a high protein diet or have diabetes or metabolic syndromes. Certain genetic factors can also increase that risk of getting uric acid stones. So it's really important to make sure you're getting enough water. If you have chronic diarrhea, whether that be due to certain illnesses that you may have at the time, like an ongoing stomach virus, or if you are having chronic diarrhea due to GI tract issues, or specifically related to being on antibiotics for a while, perhaps due to having struvite stones and a UTI, then it is important to make sure you are getting extra fluid to make sure you do not get uric acid stones as well. Lastly, cysteine stones form in folks who have a hereditary condition called cystinuria, and that causes the kidneys to excrete too much of a particular amino acid and thereby cause cystine stones. So for the risk factors, if you have family or personal history of kidney stones, you're more likely to develop them. Not drinking enough water or sweating a lot. So if you live in a warm, dry climate, that can also give you a higher risk of developing kidney stones, as well as high protein diets, a lot of sodium or sugar intake, obesity, digestive diseases, and surgeries like gastric bypass or IBS, or other medical conditions like renal tubular acidosis, cystinuria, or even certain supplements and medications like vitamin C or dietary supplements, excessive use of laxatives, calcium-based antacids, and so on. So I was fortunate as a small child to not experience this. I have not experienced kidney stones personally, as far as I'm aware. But I did also used to pop Rolaids and other types of antacids like they were candy, because my grandmother had those readily available in her home. So, go ahead and make sure that if you think that's a harmless treat for your kids, that you are double checking how much they are intaking with those and how much their little bodies truly need. Because even though it's not seeming like it's going to hurt their body in any way, having too much calcium-based antacids can in fact result in kidney stones. We're going to go on a quick break, and when we come back, we're going to talk about UTIs. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about kidney health, specifically as it relates to kidney stones. The causes of them, the types of stones, their compositions, and when to go see a doctor. Now we're going to talk about UTIs, or urinary tract infections. So UTIs are something that you may be quite familiar with. Have you ever had to stop to pee frequently, but you kept feeling that you had to pee? However, every time you go to pee, you only pee a little bit? That is likely a UTI. So UTIs are responsible for over 8 million visits to doctors in the U.S. each year. 60% of women specifically have at least one UTI in their lifetime. They're very common, but I don't think that they are talked about enough. So we're going to talk about what a UTI is, the different types, and the symptoms to look out for. So a UTI, urinary tract infection, is when bacteria infect any part of your urinary tract. And as we discussed in our first segment, that includes our kidneys, ureters, bladder, and urethra. So the urine is produced in each kidney, and then it goes down that ureter tube to the bladder, where it's stored for those typically 2 to 5 hours, depending on how much you're drinking, until you are told by your nerves in the area that it's time to pee. Then the urine is going to pass through your urethra as your bladder goes ahead and compresses, while those sphincter muscles go ahead and loosen up or relax, and then your urine goes from the bladder to the outside of your body via your urethra. So when you get a UTI, you are most likely getting them in your bladder. That is the urinary tract organ that is most affected. There are different types of UTIs though. You can have a UTI, a bladder infection, a kidney infection, and we tend to think of those as being different types of infections because they are in different organs. But truly, they're all part of your urinary tract or your urinary system. So the different names are just telling you how far up your urinary tract the infection has gone. So these are actually all types of UTIs. UTI is just an umbrella term for any bacterial infection in your urinary tract. And then the specific names like bladder or kidney infection just tell you which specific organs within the tract are affected. So one of the things that you might expect with a UTI is an infection in the lower urinary tract, specifically your urethra and your bladder. A complicated UTI is when you get the infection and it extends beyond your bladder to the kidneys, at which point it becomes more serious. UTIs are considered complicated during pregnancy, after menopause, and when there are other issues, like kidney stones. If it's just in the bladder or the urethra, then they're termed to typically be uncomplicated. So what are the symptoms to look out for? Symptoms tend to be frequently peeing. So in a work day, that could be 6 to 8 times or more or less. Just depends on your normal patterns, how much fluids you are taking into your body, and so on. So it's not specifically something that you can count, but peeing more frequently than you normally do, or feeling like you need to pee constantly, but only a little bit of pee comes out. It can really mess up your work day, you guys, or your class day, or, even just your day off. No matter which day you get a UTI, it can be quite a pain. And some symptoms of an uncomplicated UTI, so the ones found in your urethra and your bladder, are painful or difficult urination. That's called dysuria, or having to pee a lot of times in a day, having the sudden urge to have to pee, or having pain in the lowest part of your abdomen, or pink and or cloudy urine. So if you have a complicated UTI, which means it's made its way up towards the kidneys, then you may also experience fever, chills, shivering. You could feel nauseous or even vomit, have severe fatigue or malaise, have discomfort in your upper abdomen or your back. Remember that your kidneys are below your rib cage and positioned more closely to your back. So what you may be feeling as back pain could be associated with a kidney infection or another form of urinary tract infection instead. And you may feel some pain when you lightly palpate over the kidneys below the ribs in your back. So specific combinations of those symptoms are found with UTIs more so than other conditions that may affect your organs. If you have pain when you're urinating and having to urinate several times a day, but you don't have any vaginal discharge, then that raises the likelihood of that condition being due to a UTI to be more than 90%. That is how disproportionate these certain symptoms are when combined compared to other issues that may be related. And it's the principle of looking for horses. Don't look for a zebra when it may just be a horse. So if you're having these symptoms, don't go freak yourself out on WebMD. Go ahead and speak with your doctor. It is much more likely to be a UTI. Now, if those symptoms don't entirely match a UTI, it could also be an STI. So a sexually transmitted infection. We used to call those STDs, but now the vernacular is more commonly STIs. It could be a yeast infection or painful bladder syndrome. Those are some of the most common disorders that are mistaken for UTIs. So it's important that you visit your doctor so they can give you an accurate diagnosis and make sure you're getting the appropriate course of treatment. If you are getting a yeast infection, that is going to be a different treatment than getting antibiotics for a UTI. Same thing for an STI. It really depends on which type of infection that you have. So if you are experiencing discharge or itching in the vaginal area, referred to as vaginal pruritus, or burning sensations at the end of urinating, then those are non-UTI symptoms, and you should especially let your doctor know about those so you can make sure you get an accurate diagnosis. Otherwise, they may think that it's just a UTI. So now I'm going to hit you with some risk factors. If you have had a UTI before, you are 80% more likely, if you are a woman, to have another UTI during your lifetime. Repeat infections are actually quite common. After a UTI, a woman can also experience a relapse, which is getting that same infection within 2 weeks of the original symptoms. A lot of times, women can also experience reinfection, and that's when a second UTI is caused by a completely new infection more than 2 weeks later. So it might be a totally different type of bacteria or a different strain within that same bacterial family. So some people get UTIs more often than others, and some of these risk factors are being female, having a short distance from the anus to the urethra, that opening where urine exits the body. Due to differences between male and female anatomy, it's just more likely. You only have really the space of the perineum between your anus and where your vulva is, if you're female. And when you have your vulva that close, it's also going to have your urethra a lot closer than you would if, say, you were male, because the urethra on a penis is at the head of the penis. It's at the tip of the glands. So you are less likely to have that come as closely into contact with the bacteria that are naturally associated with the lower bowels and are excreted through the anus than women are. So if you have a penis, that is why you are less likely to get a UTI than women are. It's just anatomy. So if you have a history of UTIs, especially if you had one in the past 12 months, then you may be more likely to get another one. If you have a maternal history of UTIs, so your mom, and so on. If you have any urinary tract abnormalities, like you've had kidney stones, or if you have passed menopause, there are some changes in the microorganisms in your vaginal area that can lead to kidney stones just naturally. If you have diabetes, or you have new sexual partners in the last year, if you have recent or frequent sexual intercourse, or you're not urinating before or after intercourse, or you're using spermicide or spermicide-coated condoms, using a diaphragm or non-cotton underwear, this can all lead to giving you a UTI. And I'd want to go ahead and approach the stigma for this, you guys. I know that when you go to see a doctor, the first thing that they generally say to you is, are you making sure that you are wiping front to back if you are a woman? And we have been told that since we were little girls. It can feel kind of infantilizing when they say that. But I don't want you to think that people are going to judge you for having a UTI. It's something that happens to a lot of people. 60% of women are likely to have a UTI, and 80% of those women who have already experienced a UTI before are likely to have multiple UTIs in their lifetimes. You are not alone. We are all in this together as ladies, as folks who have a vulva in general. It's just down to anatomy a lot of times. And as I've listed off with these risk factors, just a natural history of your ancestors having them or undergoing the very natural process of menopause as we age, or having what may seem to be totally unrelated issues like diabetes or just having sex. Now, when we mention intercourse, we are not saying that it is an STI. Just the act of having sexual partners, whether that is the same partner throughout the year and you're just having sex frequently or you have recently, or if you have had new sexual partners in the past year, that can lead to that. That's why it's important to make sure you pee after sexual intercourse. You also want to be careful with spermicide or spermicide-coated condoms because that substance can really get backed up into your urethra, and that can thereby result in bacteria. Because there is, of course, the condom itself with the spermicide substance, but there's also all of the other fluids that are naturally emitted by all types of bodies during the process of intercourse. And they're meant to come out of our bodies, but sometimes just due to normal actions in intercourse, they can be pushed inside of the urethra. It's kind of like building a water reclamation facility right next to a natural spring that then when it floods, you get a cross-contamination of that water reclamation facility with the wastewater in there rising along with the natural spring until you have some cross-contamination in there. That's all it is. We build those further apart from each other to help make sure that does not happen. In the case of the human body, there's no way to unring that bell, you guys. That's just where they are. If I could relocate my urethra to a different part of my body, then I think I would. Just because peeing right now as a person who has a vulva and a urethra is often a chore. But mostly, I'm just salty that I can't write my name in the snow. Regardless, I want you guys to not feel self-conscious if you have a UTI. It is actually really normal. And we're going to talk about some more urinary tract health in our next segment. Stay tuned.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were introducing the concepts of UTIs in our bodies as they relate to the risk factors, as well as some numbers regarding how many people really tend to get UTIs. I feel that it's under-discussed because it is part of our excretion systems, and since it's associated in the anatomical area of our genitalia, we tend to not discuss it like it is a taboo. So I want to demystify some of that today with this episode. As we discussed, having a shorter distance from your anus to your urethra can make you more likely to have a UTI, as can anything that is related to the process of intercourse and having a family history, or even undergoing normal bodily processes like menopause or having metabolic disorders like diabetes. Bacteria is normally found inside and outside of your body, That's just the way it works. But certain types of bacteria are best for our body in different locations. And when they encroach into a different territory, then that can cause a problem in the other parts of our body that are not prepared for them and are not a good host environment. So when you get bacteria from your gut or your skin and it travels up your urethra to your bladder, it can multiply there and cause an infection. E. coli is regularly found in your gut, and as we discussed in a previous episode, most of the bacteria in your body is found in your lower gut. So that is also part of the reason why it's the most common bacteria that causes UTIs. And that's one of the reasons why doctors ask you that question first. So some women are also more likely to get UTIs no matter what they do. But some of the prevention techniques are actually really chill and easy to perform. So I'm going to list some of those off for you guys. First up, just like pretty much every other podcast in which I'm speaking with you guys, drink more water, y'all. That is what's up. Water is going to help prevent a host of issues in your body. Urinate every 2 to 3 hours. If you're drinking your water, especially in those containers that have those tick marks, and you can assign the times of day to it, so by 2 p.m. I want to have drank this much water, at 4 p.m. this much, then it can also help you to keep track of how much you're having to pee. Now I know that peeing is one of the biggest waste of time in my personal life anyway, and it's one of the things that makes me feel the most like a video game character from The Sims. It truly makes me feel like a Sim, you guys. But it is also very important. So you don't want to hold it for too long. Even though your bladder can hold it for up to about 5 hours, you really want to be going every 2 to 3 just to keep the plumbing in proper working condition. You also need to urinate before and after sexual intercourse and wipe from front to back after urinating or defecating. Then also, if you have diabetes, manage your diabetes in whatever form of treatment you and your doctor have decided together. You can also make sure that you're not trying to use vaginal deodorants or douches. Those can cause UTIs. So don't be using those. Do not use diaphragms or spermicide or unlubricated condoms. They also recommend that you don't remain in wet clothes or swimsuits. So if you've gone down to the river or you are excessively sweaty from working out and everything, not only can you perhaps get a yeast infection from that, but you can also end up with a UTI. You don't want to be on antifungals and antibiotics, y'all. Let's go ahead and just get out of those wet clothes and into some dry clothes. Also, avoid wearing non-cotton underwear. Now, if you like non-cotton underwear, more power to you. But on the days in which your outfit does not call for a form of non-cotton underwear, consider wearing that cotton underwear just to give your urinary tract kind of a break. UTIs can be really painful and inconvenient, and the best way to deal with it is just to prevent it from happening. A lot of times the symptoms seem to come on quite suddenly and can be a huge pain. If you do end up having to go to your doctor for a UTI, they will typically have you pee into a cup using the clean catch method in the bathroom. So you're going to start peeing a little bit just to eliminate any bacteria that may have been on the exterior surface of your urethral opening, whether that be near the glands or the vulva. And then you are going to pull the cup in as you are peeing midstream and catch the urine in that cup. It is okay if you get some pee on the side of it. That's just part of the process. And you can go ahead and wipe that off in the bathroom because they don't have you do this in the exam room, you guys. They should be having you do this in the bathroom. Then you can go ahead and put the cap on it and everything. They usually have markers in there for you too to write your name. I recommend doing your name before you pee in the cup. and then go ahead and place it into this neat little shelf or wherever they told you to put it, and they will take it and find out what type of bacteria specifically is inside of your urine and causing your UTI. As we discussed in our episode on antibiotics, there are many different types of bacteria. There's gram-negative and gram-positive bacteria, and then within those two subcategories, there are a whole host of other types of bacteria. And even when you get to specific individual types, you can have different strains of the same ones because their life cycles are truly so short that they are able to evolve rapidly. As we discussed in that episode, some of them are going through their entire life cycles in as little as 12 hours. And in that way, they're able to evolve a lot more rapidly than we are as humans on a nearly exponential scale, really. So that's why your doctor wants you to pee in the cup. Even if you have already had UTIs before and you go, hey, I already know what this is, they need to confirm it with those tests, and it's important to see which specific type of bacteria you are dealing with. It's important for them to know if it's an antibiotic resistant form as well, especially if you have had these before, because in that case, the type of antibiotics they used for you last time may not be effective in this case. They want to go ahead and knock this out as quickly as possible without you having to be on a ton of different antibiotics. Because remember, some types of antibiotics can also result in diarrhea. And that is more common with longer courses of antibiotics. Like 7 to 10 days, which is not all that atypical for antibiotics if you think about it. And in those cases, if you're not able to get enough probiotics to stave off the diarrhea, then you can also be more likely to get a secondary infection with UTIs or even some type of stones. Remember that while struvite stones tend to be caused as a response to a urinary tract infection, uric acid stones tend to form when folks lose too much fluid due to chronic diarrhea as one of the causes. So that's really important to keep in mind. You don't want to get any type of kidney stones, but you're already prone to struvite stones if you currently have a UTI, and if you then get diarrhea on top of that from prolonged antibiotics use, then you can also end up with uric acid stones, especially if you have a high protein diet or have diabetes or metabolic syndrome. So keep that in mind. Make sure you're staying well hydrated to help prevent these issues. We're going to go on a quick break, and when we come back, we're going to talk about how to keep our bladders healthy as we age, as well as how to spot some of these similar issues in our pets. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were wrapping up our segment on UTIs. So ways to prevent it, including the do's and don'ts, as well as making sure we understand the process we may expect at the doctor's office and potential complications from not accurately diagnosing our UTIs. So now we're going to talk about how to recognize these symptoms in our pets and also how to balance our bladder health as we age. So just like humans can get these symptoms and have these urinary tract problems, cats can have them too. So the reason I am aware of this is I had a cat who had a UTI once. So he was getting these little crystals in his urine, and they weren't quite to the point that they were full on kidney stones, but he was not a happy kitty. He was peeing a lot more, going in and out of his litter box frequently, but when I would go to scoop his litter, there wouldn't be much urine in there. He was also urinating outside of his litter box, and his urine was dark. They can have blood in their urine just like we do. They may also yowl when they urinate or have increased thirst. So this is a little bit easier to notice with cats perhaps, although if there's only one person in the home regularly walking a dog or cleaning out rabbit cages or guinea pig cages, then it may be more likely that you will notice it. So in my case, we went ahead and took the cat to the vet, and they diagnosed him and found out what was going on. Now, I was not able to see in his litter box that the urine was darker than normal, but when he started peeing right outside of his litter box, that's when I could see it, and that's when I knew it was a problem. He wasn't particularly prone to peeing outside of his litter box. He was a good boy, y'all. But when they start doing that, sometimes it's not a behavioral issue. It may in fact be a medical issue, and it's important to take a look at what the urine or the feces looks like before you clean it up, just to make sure that there's nothing abnormal that could be contributing to that. Make sure that the consistency is rather normal and the color. I know it doesn't sound like a fun time, but hey, that's what we sign up for as being pet pals. So make sure you are checking that out for your pets and keeping an eye on them. See if they are changing the frequency of the urination, if they suddenly start peeing on things for seemingly no reason, especially if you haven't introduced any changes into their environment lately, like moving or bringing something new into the house, whether that be a baby or some furniture or another animal. It's important to keep that in mind to make sure your little pal is doing all right. Male cats in particular are more prone to urethral blockages. So that's very interesting because female humans are the ones that are more likely. But in cats, it's more likely to be males, and my cat was a male. You can also make sure that you're keeping an eye on how much water they are drinking each day, as that can be a solid sign too. Now we're going to talk a little bit about keeping our bladder healthy as we age. Each day, the typical healthy adult will pass about 1.5 quarts of urine through the bladder, down the urethra, and out of the body. Now, as we get older though, our bladders tend to change, and that can increase the likelihood of bladder infections, urinary incontinence, and UTIs. We can't control everything that affects our bladder health, but we're going to try to control the variables that we can. So I'm going to give you guys some tips to keep your bladder healthy. I'll make this first one brief because we've already said it today. Drink enough fluids, especially water. We want to drink 8 8-ounce glasses of water each day for healthy adults. Now, if you are having more issues, especially related to UTIs, etc., drink even more. If you are in a particularly hot climate or you spend a lot of time outdoors, drink more than those 64 ounces per day. Water is going to be your best fluid for bladder health. And if you don't love water and you are trying to get your fluids in other ways, try to make at least half of your fluid intake water. Some folks need to drink less water because they have certain conditions like kidney issues or heart diseases, and you can really speak with your healthcare provider to find out how much is really appropriate and healthy for you. Reducing your intake of alcohol, caffeinated foods, and beverages like coffee, soda, tea, chocolate can also help. If you smoke, Taking steps to quit can also help you keep your bladder healthy. Avoiding constipation, same thing. So you can do that by eating lots of high fiber foods like those whole grains, vegetables, and fruits. Remember, whole fruit, not fruit juice. You need the fiber that's in there to process that fructose in your body and avoid giving your body other issues related to insulin levels, etc. You also want to try to keep a healthy weight. By making healthy food choices and being physically active, it can in general help you keep a healthy weight. However, lots of folks have issues that go beyond that. Folks who have thyroid issues or other types of medical problems may be more likely to be overweight, and that shouldn't be a cause for shame. Remember, we are here to do our best with the resources and circumstances that we have as individuals, and we are trying to make better choices, not perfect choices. Sometimes we are left with the options that we have. I learned that in sci-fi from Jack O'Neill on Stargate. Sometimes there is no good option. There's just a better option than the other options, and that's what we go with. So do what you can with the resources that you have, but don't beat yourself up about any of that. In addition to exercise and a good diet, you can also do pelvic floor muscle exercises. So Kegels, y'all. Kegels help hold your urine in your bladder, and performing these each day can really help strengthen your muscles and keep urine from leaking when you sneeze or cough or lift something or laugh or even just have a sudden urge to urinate. Performing regular exercise in general can also help prevent bladder problems in addition to constipation. So it's not just about weight when it comes to physical activity. It can keep you healthy in many different ways, including your urinary tract and your GI tract. You should also use the bathroom often and whenever you need to. If you look at the clock and you can't remember the last time you urinated, or it's been 4 hours, 3 to 4 hours, go ahead and go. Remember, it's the mom road trip principle or the bedtime principle. Go ahead and try to go to the bathroom. Mom, I don't need to go. Just go ahead and try. Most of the time, even if you don't feel the urge to go immediately, you are still going to be able to go. Remember, those nerves are there to let you know when you need to pee, but you can also go before you truly need to pee, much like the concept of dehydration. By the time you are thirsty, you are already dehydrated. So by the time you feel the need to pee, technically your bladder is already full. You can stretch it beyond its limits, literally like a balloon, but that is inadvisable and not great for your body. So go ahead and pee if you can't remember the last time you peed, or if it's been at least 3 to 4 hours. We don't have to actually wait until it is telling us we need to go or that it is an emergency. You also want to take enough time to fully empty your bladder when urinating, so try not to rush yourself. You want to make sure that you get all the urine out to reduce the likelihood of having stale urine in there and getting a bladder infection. Also, try to be in a relaxed position when you're urinating. Relaxing those muscles tends to make it easier to empty your bladder. So for women, hovering over the toilet seat might make it hard to relax. I know that we're trying to avoid germs, but a lot of doctors say that it is better to sit down in order to fully relax. Go ahead and put some toilet paper or a liner on that. I totally get where you're coming from, but if the hovering makes it too hard for you to relax, you really might want to consider that to prevent UTIs. Germs abound everywhere, y'all. You also want to urinate after sex, both men and women, to go ahead and flush away any bacteria that might have entered the urethra during sex, and wear cotton underwear and loose-fitting clothing to keep the area around the urethra dry. If you wear a lot of tight-fitting jeans or nylon underwear, it can really trap moisture in there, and bacteria thrives in warm, moist environments. Alright, I hope you guys learned a lot about your bodies today, how to keep your urinary tract healthy, and signs and symptoms that signify you should go see a doctor. Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.